Blazing Hot 921, we will get through this together. Right now, we're at 11 minutes after the 9 o'clock hour, and it's time for Health, Healing, and Hampton Roads.
Good morning, INC, and every single Wednesday, we got to take a pause for the calls and talk about health, healing, and Hampton Roads and how they all intermingle together. Now, today, I'd like to welcome to the studio. It's been a long time since I had a chance to actually say that. Welcome to the studio, Dr. Vanessa Blowe. Good morning, Dr. Blowe.
Good morning, everybody, and welcome. Glad for the opportunity to speak with you.
There you go. Dr. Blowe is the chief medical physician here at Norfolk State University, and we're going to talk about a couple things, Dr. Blowe. We're going to talk about COVID-19 vaccination, and we're going to also talk about what the CDC has actually set some new guidelines, and we got to pay attention to that, Dr. Blowe.
We certainly do.
All right, first, let's talk about the vaccination. COVID-19 has been around for some time now, and, the vaccine has actually been released for consumption, and we're talking about, getting the vaccine in as many people as we possibly can. Let's talk about, the vaccination and getting it into the arms of people.
Well, we really are looking at quite a varying methods of doing that. We've got several things going on right here on campus, May 5th, today, from 2 to 7 o'clock. There's going to be a vaccination mass clinic here in association with Centera Medical Group. Not Centera Medical Group, but Centera Hospitals. And it's open to students and to the public. So it's a great opportunity. This is for a Pfizer vaccine. Currently, there's also at the Military Circle Mall, where the previous Hex used to be, and you can tell how old I am by mentioning Hex. There is FEMA vaccines, walk up, no appointments needed, and there's various things going on with the Department of Health and various community groups and churches. So get out there, look for that Vaccinated Virginia on the website. If you go to the VDH, there's an opportunity there to look for the information. You can also call 1-877-829-4682, and that's the Vax in Virginia phone number to be used for anybody to find out where they can get a vaccination near them.
Now, Dr. Blowe, I was just listening to news radio on yesterday, and they were talking about we're now getting ready to turn towards vaccinating children or people who are a little bit younger, all the way into their teens area, and they're going to be hesitant right now to actually start to do the younger children. Now, they're talking about somewhere possibly around like July rolling it out so that our teens and people that are younger can get vaccinated.
That's correct. Currently, there are ongoing studies, again, where, people are being cautious and looking at the information. So they are currently studying children between the ages of 12 and 16 who are not currently covered by the emergency authorized use of the current vaccines, and they're looking at our current vaccines in those age groups. So that's 12 to 16, and hopefully we'll have that information shortly.
Have you actually heard, also, they were looking at potentially with the dosages, reducing some of the dosages for the children that were actually younger. They were saying that even the stronger doses can actually be given to the teens. And they were looking at potentially studying the youth for a little bit younger to adjust the dosages for the younger children.
Yes, that is something that does commonly occur in vaccinations, that the younger people, due to their smaller size, but also their immune system reactivity, that often that the dose that the youngest children get is smaller than an adult would get.
Gotcha. So also, within the last few weeks, the Center for Disease Control has released a whole new parameters of mandates, or I should say loosening some of the mandates. And we have to make sure that we fully understand some of those mandates and being relaxed. Because as I was reading through it, some of the things that we are interpreting are totally wrong than what the CDC is actually saying.
Well, I hope you don't interpret too wrongly. So, main thing, go to the CDC website, read it for yourself. Don't rely on everybody else. You know how it gets if you're doing a phone line. As soon as the message gets past the second person, it's a little different than it started. So go get to the source yourself and find out, and just understand fully vaccinated. That means that you have had either one dose of the Johnson & Johnson and it's been more than 2 weeks since your dose, or you've had 2 of the Pfizer or Moderna vaccines and it's been more than 2 weeks since your last dose. Then you can consider yourself fully vaccinated. If you've only had the 1 dose, or it's been less than 2 weeks since your final dose, then you are considered partially vaccinated. So there may be a little difference in the things that you want to do or the exposures you want to get yourself involved in.
Now, in doing preparation for this, I looked at the CDC's website, and it says if you are fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask or staying 6 feet apart. Hold on. Let's underline something. If you are fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. A lot of people are interpreting, okay, I'm fully vaccinated, I can take off my mask, period. But it says if you pretty much gather with other fully vaccinated people. And that is becoming a big misinterpretation in our community.
Yeah, so you really need to understand fully vaccinated and fully vaccinated. So people on equal terms, you can get indoors and not have to do that distancing. If you're not sure of what the other person's status is, you want to use a little precaution. I know some people are saying, we're doing too precautious, but when it comes to something like this, where there's a virus that can actually end up with you having severe illness or death even, I think a little caution is necessary, especially in the beginning until things tend to unfold and we see how things really work out.
You're listening to Health Healing and Hampton Roads. We're on, I was getting ready to say we're on the line, but we have in the studio, long time since I actually had been able to say that, Dr. Vanessa Blowe. And Dr. Blowe, the CDC also says you can gather or conduct activities outdoors without wearing a mask, except in certain crowded settings or in venues.
Exactly. So the larger the crowd, a little more risk. There may be somebody there who could spread the disease. So try and know who you're around. And outdoors, the reason there's a lot of circulation of air, and so you're not going to be directly impacted by those air droplets as much as if you would if you were indoors.
Now, they go on to say if you're fully vaccinated, you should still protect yourself and others in many situations by wearing a mask that fits snugly around the sides of your face and doesn't have gaps. Take this precaution when you're indoor public settings, gathering indoors with unvaccinated people, visiting indoors and unvaccinated persons as well. So they definitely go on to clarify some of the misnomers that we're taking from what the CDC actually said.
So it's real important, always think, am I around other people who are vaccinated? Am I inside? Am I outside? That makes a big difference. If you're traveling, you're in a public place where you may be moving about, again, the more unknowns you have, that may increase your risk. And so those are the times you want to still wear that mask if you're traveling on public transportation. If you're in a very large group, we're talking going to like a sports event or something like that where they're indoors and you're not sure of the situation, it wouldn't hurt to wear your mask, even if you're fully vaccinated.
Dr. Blowe, from your professional career, what would you say to someone now that is still not looking at getting vaccinated?
Well, I would like to know what questions that person has. It's very important to find out, what is the hesitation, what are the questions that they have, and see if you're able to answer that person's questions fully. We don't want to demean people or to make people feel uncomfortable. We want people to feel comfortable. So if you need to speak with your family doctor or close healthcare person that you know, then you need to do that if that helps you to understand better and to have a better sense of security about getting the vaccine. I think one thing is, we should know that there's a large number of people have been vaccinated. We have over 6 million doses administered, in just Virginia. So I think if we're going to see, severe side effects or adverse effects, those are the types of things that we would be seeing by now. So I think we can get some reassurance by that.
And I was also listening to some of the things when they were talking about reaching herd immunity now, and looking at that the United States may not soon reach herd immunity as potentially thought about.
Well, and there's herd immunity means that we've got a large proportion of the population that has immunity, and so they're not able to spread the virus, they cannot contract the virus, and so in order for that to happen, it has to be, we're looking upwards of 70% of the population vaccinated in order for that to happen. So that's something, that may take a little challenge to get to that point, and that's why it's important for people who are not sure they should get vaccinated to, understand that getting vaccinated may not only just help yourself, but it can help your neighbors, your community, your country.
Well, Dr. Blowe, any final words that you would like to leave with our audience today?
I would just like for everybody to stay positive. I know it's been a rough year, but I think if we have a tool that we can use to help us, then we ought to go ahead and reach out for that tool. If you are not understanding what the benefits of the tool are, then try and get as much information as you can and get to that process as you feel comfortable and understand how it can help you.
Well, Dr. Blowe, thank you so much for taking time out of your busy schedule to actually come into the studio and talk about this serious issue of getting vaccinated in VA and here at Norfolk State University and what Norfolk State is doing. One more time, give us that information about that vaccination that is going on today.
Eccles Hall, 2 o'clock to 7 o'clock tonight. You can go in and get your vaccine. You can look at the campus announcements. There is a little QR code that you can pull up and register so that you can get vaccinated. And this is open not just to students and faculty and staff, but also to the public.
All right. Well, thank you so much, Dr. Blowe. That's Health, Healing, and Hampton Roads, INC.
Thank you so once again.
Thank you so much, Dr. Blowe. And now you know, and G.I. Joe says knowing is half the battle. The other half of the battle is probably going to be getting the vaccine. So let's get in this battle together. We got more music when we come back. We're Blazing Hot 91, and we will get through this together.